Hey everyone, and welcome back to our channel. Today we're diving into a topic that affects millions of people around the world, yet is often misunderstood: phobias. What are they, really? And how are they different from just being scared of something? Let's get into it. So, at its core, a phobia is an overwhelming and often debilitating fear of a specific object, place, situation, feeling, or even an animal. The key difference between a fear and a phobia is the intensity. While most people might feel a bit uneasy seeing a spider, someone with arachnophobia experiences an intense, exaggerated sense of danger that's completely out of proportion to the actual threat. It's more than just a strong dislike. It's a powerful, persistent fear. For someone with a severe phobia, their life can start to revolve around avoiding the trigger. This avoidance isn't just a minor inconvenience. It can seriously restrict their day-to-day life and cause immense distress. Imagine planning your entire commute to avoid a certain bridge, or turning down social events because of an intense fear of crowds. That's the reality for many. A phobia is actually a type of anxiety disorder. You might not feel any symptoms until you're face-to-face with your fear trigger. However, for some, just thinking about the source of the phobia is enough to bring on feelings of anxiety or even a full-blown panic attack. This is called anticipatory anxiety, essentially, fearing the fear itself. When someone with a phobia encounters their trigger, the physical response can be dramatic. Symptoms can include feeling unsteady, dizzy, or lightheaded. You might experience nausea, start sweating, or feel your heart racing or pounding in your chest. Shortness of breath, trembling, shaking, and an upset stomach are also very common. It's a full-body fight-or-flight response, even when there's no real danger. Now, the impact of a phobia really depends on how often you encounter your trigger. If you have a phobia of snakes and you live in a city, it might not affect your daily life very much. But if you have what's called a complex phobia, like agoraphobia, just leading a normal life can feel like an impossible challenge. So, let's break down the different types of phobias. Generally, they fall into two main categories: specific or simple phobias and complex phobias. Specific or simple phobias are the ones we tend to hear about most often. They center around a particular object, animal, situation, or activity. These usually develop during childhood or adolescence, and for some, they can become less severe with age. Common examples are probably familiar to you. There are animal phobias, like the fear of dogs, spiders, or rodents. Environmental phobias include things like a fear of heights, deep water, or germs. Then you have situational phobias, like a fear of flying or visiting the dentist. Bodily phobias involve a fear of things like blood, vomit, or getting injections. On the other hand, we have complex phobias. These tend to be much more disabling than simple phobias. They usually develop in adulthood and are often tied to a deep-rooted anxiety about a particular situation or circumstance. The two most common complex phobias are agoraphobia and social phobia. Agoraphobia is often mistaken for just a fear of open spaces, but it's much more nuanced. Someone with agoraphobia feels intense anxiety about being in a place or situation where escape might be difficult if they were to have a panic attack. This isn't just about open fields. It can be about crowded places, public transport, or even just being alone. The anxiety often leads them to avoid these situations altogether, which can make them feel trapped in their own homes. Then there's social phobia, which is also known as social anxiety disorder. This is a powerful fear of social situations. People with social phobia might be terrified of speaking in front of others, not because they're shy, but because they have an intense fear of embarrassing themselves or being humiliated. In severe cases, this can prevent them from doing everyday things we take for granted, like eating at a restaurant or meeting up with friends. So, where do these phobias even come from? It's not as simple as one single cause. Instead, it seems to be a combination of factors. A phobia might be linked to a specific traumatic incident from the past. For example, a scary experience with a dog in childhood could lead to a lifelong phobia. Phobias can also be a learned response. A child might develop a fear of spiders by observing a parent's terrified reaction to them. Genetics might play a role too. There's evidence suggesting some people are simply born with a greater tendency towards anxiety than others, making them more susceptible to developing phobias. When it comes to diagnosis, it's interesting because phobias aren't always formally diagnosed. Most people who have one are very aware of the problem. They know their fear is irrational, but they can't control it. Often, a person will simply choose to live with their phobia, carefully avoiding whatever it is they're afraid of. But here's the catch. Constantly avoiding your fear can actually make it stronger. It reinforces the idea that the thing you fear is genuinely dangerous and that you are incapable of coping with it. That's why seeking help is so important. If you have a phobia that's impacting your life, a good first step is talking to a doctor. They can refer you to a specialist, like a psychologist who is an expert in behavioral therapy. In many places, you can even refer yourself directly to talking therapy services. And this brings us to the good news. Most phobias can be treated successfully. For simple phobias, a common and highly effective treatment is gradual exposure therapy, also known as desensitization. This involves slowly and safely exposing yourself to the thing you fear until the anxiety begins to fade. This can be done with the help of a professional or even through a self-help program. The goal is to teach your brain that the feared object or situation is not actually a threat. Treating complex phobias like agoraphobia or social phobia often takes a bit longer and usually involves talking therapies. Things like counseling, psychotherapy, and especially cognitive behavioral therapy, or CBT, are very effective. CBT helps people to identify and challenge their negative thought patterns and behaviors, and develop better coping strategies. In some cases, medication might also be prescribed to help manage the anxiety symptoms associated with a phobia. This can include certain antidepressants, tranquilizers, or beta blockers, which can help control the physical symptoms like a racing heart. Just how common are phobias? They are one of the most common types of anxiety disorders out there. They can affect anyone, at any age, from any background. Some of the most frequently reported phobias include arachnophobia, the fear of spiders, claustrophobia, the fear of confined spaces, agoraphobia, the fear of open or crowded spaces, and social phobia, the fear of social situations. The most important takeaway here is that if you're struggling with a phobia, you are not alone, and there is effective help available. It takes courage to face a fear, but it is absolutely possible to overcome it and regain control of your life. Don't let a phobia limit your world. Reaching out is the first and most powerful step. Thank you so much for watching today. I hope this gave you a clearer understanding of what phobias are. If you found this video helpful, please give it a thumbs up and consider subscribing for more content. And as always, take care of yourselves and each other. See you in the next one.